Hey everyone, and welcome. Today we're diving deep into a condition that honestly affects millions of people, HFrEF. That stands for heart failure with a reduced ejection fraction. We're going to break down what it is, how it actually works inside the body, and then get to the really exciting part, the revolutionary treatments that are completely changing the game.
So, here's our game plan. We'll kick things off by defining what we're even talking about. Then we're going to zoom all the way in to see what's happening at the cellular level. After that, we'll cover how doctors diagnose it, and finally, we'll get to the incredible new standard of care that's making a huge difference in patients' lives.
Okay, first things first. What exactly is heart failure? You know, it's a term we hear a lot, but what does it mean? Well, believe it or not, there's actually a universal definition that experts all over the world have agreed on. And the key word right here is syndrome. This is super important. Heart failure isn't like a heart attack, which is a single event. Nope, it's a clinical syndrome. It's a condition where the heart has some kind of structural or functional problem, and because of that, it just can't keep up. It can't pump enough blood to meet the body's demands. And that leads to a whole cascade of symptoms and signs, which we're going to talk about in just a bit.
All right, so to really understand and classify the different types of heart failure, doctors use one measurement that is absolutely critical. It's called the ejection fraction. So what the heck is that?
Let's use an analogy. Think of your heart's main pumping chamber, that's the left ventricle, as a water pump. The ejection fraction, or EF for short, is basically a measure of how efficiently that pump is working. A healthy heart usually has an EF above 50%. That means with every single beat, it's pushing out more than half the blood that's in the chamber. Pretty powerful, right? Okay, and this is where it gets really interesting, because this one measurement helps us split heart failure into two main types. On one side, you've got what's called hfpef. That's a stiffness problem. The heart muscle is too stiff to relax and fill up with blood properly. But today, we're focusing on the other type, HFrEF. This is the squeeze problem. The heart muscle itself is just too weak to contract and pump blood out effectively.
And that brings us to this number. This is the magic number, really. If a person's ejection fraction drops below 40%, that's the key marker. That's what officially defines HFrEF. It's a clear signal that the heart squeeze is seriously weakened.
But why? Why does the squeeze get weaker? To really get that, we have to go deeper. We need to zoom way in and look at the story that's unfolding at the microscopic level, right inside the heart muscle cells.
So at its core, the problem is often damage to the heart muscle cells themselves. They're called myocytes. Now, this damage can happen for a bunch of reasons, but a really common cause is a heart attack. Part of the heart muscle literally dies. And over time, as you lose more and more of these cells, the whole structure of the heart gets weaker and, well, it just can't do its job as well.
And what's really fascinating is that we can go even smaller. Think about it. Every single heartbeat is powered by this super precise dance of calcium moving in and out of the cells. In HFrEF, that whole system, that little engine just breaks down. And it's a two-part failure. First, not enough calcium gets released to create a good, strong squeeze. And second, too much calcium gets left behind inside the cell, which means the muscle can't fully relax and get ready for the next beat. It's a double whammy.
Okay, so that's the science, the nitty-gritty of what's happening inside the cells. But what does all that actually feel like for a person? You know, what are the real-world signs that doctors look for that diagnose HF or H?
Well, it all comes back to the heart just not being able to keep up. When that pump is weak, fluid can actually back up, almost like a traffic jam, and it often ends up in the lungs. That's what causes that classic shortness of breath. And at the same time, because the rest of your body isn't getting the oxygen-rich blood it needs, you feel just wiped out, totally fatigued and weak, especially when you try to do anything physical.
So making a diagnosis, it's really like putting together a puzzle. It's not just one thing. You've got the patient's symptoms, what they're actually feeling. Then there are blood tests that look for specific hormones like BNP, which is a key marker the heart releases when it's under a lot of stress. And then the really crucial piece is an echocardiogram. It's basically an ultrasound of the heart to actually measure that ejection fraction and confirm that it's below 40%.
All right, now we get to the most exciting part of this whole story. Honestly, for decades, progress in treating HFrEF was kind of slow. But just in the last few years, we've hit a turning point. We have entered a truly revolutionary new era for managing this condition.
I mean, think about it. Just a few years ago, the standard way to treat this was slow. It was sequential. A doctor would start one medication, slowly increase the dose over time, and then, maybe, add a second one. The new approach? It's a total 180. It calls for starting 4 different foundational drug classes. We call it quadruple therapy, and getting them all on board as quickly and as simultaneously as possible.
And this is the strategy. It's brilliant. These aren't just 4 random pills. They are 4 pillars, and each one attacks the disease from a totally different angle. You've got one that relaxes blood vessels, another that reduces the heart's workload, a third one that blocks harmful hormones, and then this fourth one, a newer class of drugs that gives incredible protection to both the heart and the kidneys. It's a full-on multi-pronged attack.
But look, this new approach, it's not just some change in a medical textbook. It is having a truly staggering, real-world impact on patients' lives.
So you gotta ask, right? Does this aggressive 4-pillar strategy actually work better than the old slow way of doing things? The answer is a resounding yes. And the data, well, the data is just breathtaking.
Check this out. When you look at the numbers, the absolute improvement in survival is just wow. It translates to this.
That's right, 6 additional years of life. A landmark study in The Lancet projected that for a typical 55-year-old patient, starting this modern quadruple therapy adds, on average, 6 more years to their life compared to the old-school treatment. I mean, come on, this isn't a tiny improvement. This is a monumental leap forward for medicine.
And get this, look at what's called the number needed to treat. This basically means we only need to treat about 4 patients with this complete therapy for just 2 years to save 1 life. To give you some perspective, for something common like statins for preventing a first heart attack, that number is closer to 100. This therapy is it's incredibly powerful.
And that really brings us to our final thought here. The science is done. We have the tools. The evidence is crystal clear. So the next great challenge, the next frontier, isn't about discovering a new treatment. It's about delivering this one. It's about figuring out how to overcome all the barriers to make sure that every single patient who is eligible for this life-extending care actually gets it, and gets it as quickly and safely as possible. And that is a frontier absolutely worth exploring.